Good afternoon again. This is Kim Beer with the Christopher and Dana Reeve Foundation. We're going to get started with our advocacy update for October. We're so thrilled that many of you have been able to join us. For those that are not able to join us, we'll be sure to send around the recording to our regional champions. If there's someone who's joined the webinar and is interested in learning more about our advocacy programs, we'll be sure to send our contact information should you want to learn more. And during the webinar today, we will be able to take questions. We'll be monitoring them in the chat box throughout the webinar. And we will also, at the end, be able to take those questions. But if we see a question during the webinar, we'll try our best to answer it in real time. Also, my colleagues and I will be placing some links in the chat box. We'll be referencing some places for you to retrieve important information. If you're unable to capture that information, we'll be sure to also send you those links in any follow-up materials that we send to you. So again, welcome. I am Kim, and today's agenda, we hope to update all of you on what's happening in Washington, D.C. in Congress. There's a lot of activity on the Hill as far as the hearings, the Supreme Court hearings are ongoing, and John is going to update us around appropriations and COVID-19 response legislation. And before we get to that, I'll give you some updates on what's happening at the Reeve Foundation, ways that you can get involved. And my colleague Chris will be talking a lot about voting and ensuring that you all have the important information to ensure that you can vote either in person or through the mail. And of course, last but not least, we really want to get the biggest Reeve virtual team that we can. We'll have our first inaugural 5K, October 17th, this Saturday, and we hope that you can join us. Next slide, please. And as I mentioned, I'm Kim. My colleagues Chris Carson and John Sawyer will be on the webinar with us today, and let's get started. Many of you are on our newsletter, and if you're not, please make sure that you sign up on our landing page to receive all updates. We are updating our especially COVID-19 information daily, and we have an upcoming webinar with Nurse Linda on October 28th. We also have blog posts and posts relevant to the pandemic, including children-related information and personal stories and how people are managing their lives during this very difficult time. And of course, our team will be constantly updating policy updates through social media and advocacy alerts. And the Process Resource Center continues to update its information and resources even during the pandemic. And as I mentioned, we have some events coming up. We have a fundraising event, Cards for the Cure. So if you're a poker player, please check that out. Those events will happen in November and December. And as I mentioned, I'll talk a little bit later about our Reeve Run and Roll 5K that will happen this Saturday. And then as we get closer to April of next year, which seems so far away, but we'll be here before we know it, we'll be holding our virtual summit. And we hope that as many of you can participate as possible. And I'll go into more details as we have more information about the agenda and speakers. Just mark your calendars, next April 27th. It'll be 3 days. We'll hold it from 12 to 7 p.m. Eastern time every day, and we're really, really excited. So now I'm going to pass it over to my colleague John Sawyer from Waxman Strategies, who will give us a congressional update, talk a little bit about appropriations and some of the stalemate with our COVID-19 response.
Great. Thank you so much, Kim. Really appreciate everybody being here today, and happy to be joining you and give you a little bit of update here from Washington, D.C. Now, normally at a time when we're less than 3 weeks from an election, we're used to members of Congress being back home, being out on the campaign trail, seeing multiple events per day happening out in the district. Obviously, this year on many different levels is a little bit different, and we'll be talking about what Congress is doing, what they are trying to figure out if they can do, what they're not doing, and some of the circumstances that have actually kept them in Washington later than usual for an election year. So we did want to just start by checking in about the fiscal year 21 appropriations process. As a reminder, this is the process that decides and determines how all the programs in the federal government will be funded going into the next fiscal year. And so we've given an update on this on recent webinars, but we focus within the appropriations process, we focus on primarily the funding for the Paralysis Resource Center, which is determined every year. Our request was for $9.7 million for the PRC this year, that request being equal to last year's funding. The House actually has passed their appropriations bills this year. It's been through subcommittee, through full committee, and the full House, and that included our full request. So we were really happy to see that. In the Senate, it's a bit of a different story due to a number of different really hot button political issues that were getting tied into appropriations. The Senate process really stalled last spring, and they did not actually end up passing any of their legislation before the first of what will likely be several deadlines. So in the normal times, you want to pass all your appropriations bills before the end of the fiscal year, October 1st. If you don't do that, either you have to pass a continuing resolution, which is legislation that basically puts the government on autopilot, extends all programs at current levels, or you have a government shutdown. And so Congress did do that. They waited until about 6 hours from the deadline, but with very little fanfare actually passed a continuing resolution on September 30th that extends government funding until December 11th. And so that means that after the election, but before a new Congress is sworn in, Congress will have to come back to Washington. They will have to figure out what to do on government funding. This is obviously not just on our program, but on thousands of programs across the government. So there's a few different ways that can go. Some of it depends on the election, but there are really three options at that point. Congress can finalize the fiscal year 21 appropriations bills. They can actually go through and pass legislation and negotiate it out line by line, how much funding each program gets. We could see another short-term continuing resolution, either, sometimes they have been known to pass one for a week or two. Obviously 2 weeks from the 11th would be until Christmas Day, so I don't think we'll see that, but sometimes they use that, the holidays as a motivator to get things done. They could also pass one into the new year. They could also pass what's called a long-term CR and basically say, instead of putting government funding on autopilot for a month, we're just going to extend the entire government's funding levels at the previous year's levels for the whole rest of the fiscal year. That's not a desirable outcome. In terms of the PRC, we wouldn't actually see much change, but across the government, you want to be able to adjust, program funding, to accommodate different priorities, to accommodate changes, and neither side really wants to see a long-term CR for the year. I think both sides do have an incentive to try to get this process finished in December so that we're starting the new year with a clean slate. In the debate, regardless of the outcome of the election. So I want to switch gears for a moment after talking about appropriations and talk about the ongoing sort of fights in Congress over COVID-19 response legislation. What we saw, and we talked about this a little bit in the last webinar, but what we saw when the pandemic really started was a flurry of activity from Congress, 3 pieces of legislation totaling more than $2 trillion worth of investments passed within a matter of weeks. What has happened since then is very little legislatively. Obviously the government has been implementing what was included in those initial pieces of legislation, but Congress itself has not been able to come to any agreement between the House, the Senate, and the White House on what the next steps need to look like in terms of COVID relief. So the House has passed legislation, the HEROES Act. That legislation, the first version was $3.5 trillion. A subsequent version and the current House position is $2.2 trillion. The Senate has introduced their own much smaller legislation, around $500 billion. Some of the programs have begun to expire, and yet we still, even as the election looms and there's major, not only political but economic and health consequences of not passing legislation, they still have not come to any agreement on COVID-19 response. So I just want to talk for a little bit about what these packages in the trillions of dollars have many, many different items in them, but some of the big things that are at stake in this fight over COVID-19 relief, and these are some of the big sticking points in these negotiations. One big thing is aid to state and local governments from the federal government. So unlike the federal government, state and most local governments cannot run deficits. And so because of the pandemic, state and local governments are expecting to see much lower tax revenue this year. And so without some outside assistance, we'll likely be forced to make major cuts to big budget items. And these things include Medicaid, it includes education, it includes criminal justice and other big budget items for state and local governments. So even though it sounds like a sort of dry budgetary question, this question of aid to state and local governments is actually a really big policy issue that affects a lot of different areas, including areas that we really follow on the Reeve team, especially related to Medicaid. It also, most of the competing proposals would include additional stimulus checks, possibly another round of checks in the $1,200 range. There's actually a little less disagreement about that. Those have proven to be, I guess, unsurprisingly, very popular. I want to hand it over actually for a quick note about stimulus checks to Chris, who has another link to share, I think, related to that.
Yeah, thank you, John. Just so everyone knows that the IRS has extended the deadline to claim your stimulus check. So if you're an individual or you have friends and family who are individuals that did not file taxes last year or do not collect Social Security, the IRS has a separate form that you can fill out and send to them. And the deadline for the millions of unclaimed dollars was supposed to be today, but they have extended it to November 21st. So I will drop the link to that form in our chat box for anyone who might need it. There we are. Thank you, John.
Thanks, Chris. And just as a reminder, as Kim said at the beginning, all the links we put in the chat today will also be in the follow-up email, along with a recording of the webinar when that becomes available. But that, the stimulus checks Chris is referencing there are from the first piece of legislation, the CARES Act, passed back in March. So there's also the big question of assistance to different industries. In the first package, there was actually targeted assistance to the airlines, who of course have been hit very hard by the pandemic. There's a big push to continue that aid, lest the airlines have to potentially lay off or furlough thousands of workers, especially in the big hub cities where they operate. There's also the small business loan program, the PPP, and extending the dates on which that can be used, as well as funding that was put in a fund specific to go to healthcare providers, hospitals, clinics, private practices, and other healthcare providers that operate through Medicare and Medicaid. Dollars for each of those industry assistance pieces are still hanging in the balance as this legislation is unclear. One of the things that Senate Republicans have pushed very clearly for is liability protections for businesses and other institutions as they reopen, wanting to make sure that businesses are protected from legal liability should people return to work and get COVID. Lastly, or I guess not lastly, but one of the other big areas is funding for testing, treatment. I didn't list it here, but contact tracing and continued funding for vaccine development, which, as folks know, is well underway. So those are just a few of the many issues I think that we are tracking that are hanging in the balance as, Congress is at this sort of stalemate over COVID relief. And just to give, again, I spoke to this a little bit earlier, but just to give a sense of sort of where the different pieces are on the board, the House has passed their legislation, $3.5 trillion in May. They actually passed a smaller version of that to try to come to the middle a little bit at $2.2 trillion earlier this month. The Senate released text of legislation that was about $1.1 trillion in the early summer that actually ran into some opposition from within the majority Republican caucus in the Senate. And what they ended up passing in the Senate, which passed with, which fell short actually of the 60 votes that are needed for this kind of legislation in the Senate, was a smaller $300 billion bill. That got a majority of votes, but again, fell short of the 60 votes needed to overcome a filibuster in the Senate. The White House position has been a little bit harder to nail down. They have been consistently negotiating directly with Speaker Pelosi in the House, mostly in the form of the Treasury Secretary, Steve Mnuchin, as well as, for a time, the White House Chief of Staff, Mark Meadows. But the positions have been shifting somewhat. So the president, by tweet, canceled the negotiations on October 6th, but then pretty quickly after that re-engaged in the negotiations, at least through Twitter, calling for standalone pieces of legislation on some of the more popular elements of these bills: stimulus checks, airline relief, and small business aid. And then at one point last week, the president's head of the Council of Economic Advisors, Larry Kudlow, said that he'd like to see a larger bill, even larger than the House bill. And then just yesterday, Secretary Mnuchin said he did not think it was likely that we would see legislation before the election. I do think, and I think when we've talked about this and talked to folks on Capitol Hill, the conventional wisdom is, never say never. And it's, Yogi Berra, it's not over till it's over. But as the election gets closer and closer, it is harder to envision the two sides or the three sides, or even more than that. Really, there's different factions within the different parties coming together on a large package like this before the election, despite what is clearly a need. Whether they can do something after the election, but before the new Congress and a potential new administration are sworn in, is really up in the air. But there is a significant likelihood that Congress and the administration won't be able to come together on something even until early next year, which, given the projections for the disease and that we may see spikes in COVID over the winter, is pretty disheartening. So we're going to be keeping a really close eye on this as things go forward, and stay tuned to action alerts and other updates from us, because this is one of those things that is changing, potentially changing by the minute. And as long as these negotiations are still potentially open, there's always some chance of a deal. So I want to shift gears then to talk about the other big thing that's happening in Washington, and anybody who's got their TVs on or news on obviously is probably seeing a lot of coverage of this. But not to be outdone for drama right now, but adding to all of these different legislative fights and legislating, I think there's the fact of taking on a Supreme Court nomination and vote this close to an election has just added to, I think, the sense of drama here, and frankly, the sense of sort of overwhelm a lot of people are feeling. So just to recap, as everyone knows, Justice Ruth Bader Ginsburg passed away after a very long battle with multiple rounds of cancer on September 18th. Almost immediately in his statement that evening, Senate Majority Leader Mitch McConnell, who really controls the Senate floor and what comes up for votes and what doesn't, committed to holding a vote on President Trump's nominee. This obviously rankled a lot of people, given the way that the Senate Majority Leader had approached nominee at the end of President Obama's term. Those folks will remember that President Obama nominated Merrick Garland for the Supreme Court after the death of Justice Scalia. And despite being 9 months before an election, Senator McConnell at that time said, that the next president should decide who should join the court. So that has added unquestionably to the intense partisan fighting over this nominee, just given that there's a sense that there's really different standards being held to here, depending on who's making the nomination. That said, President Trump nominated Judge Amy Coney Barrett to fill the seat on September 26th. Judge Barrett is currently a judge on the Seventh Circuit Court of Appeals. Hearings, as anybody who has their TV on knows, are underway in the Senate Judiciary Committee, chaired by Senator Lindsey Graham, who's also in a very tight re-election race. And so as this is going, we're keeping tabs on this. There are, the outlook in terms of timing is the Senate Judiciary Committee is likely to wrap up its hearings this week, and then they will likely vote on moving her nomination to the floor next week, and we can expect a vote on the Senate floor unless something changes the week before the election, the week of October 26th. So, obviously a number of things are at stake when it comes to the Supreme Court and the fight over the court. Judge Barrett's confirmation would change the balance of the court to 6-3 in favor of the more conservative justices on the court. Much of the focus of the hearings has been on two different cases, one that's currently pending before the court and one that is was heard almost 50 years ago in the court, but still is very top of mind for most people. The case of Texas versus California is a challenge to the Affordable Care Act being led by a number of states, led by Texas. The oral arguments in this case will be held on November 10th. And so whatever justices are present for oral arguments are the justices who can actually vote on the case going forward. So if Judge Barrett becomes Justice Barrett before the election, she will then presumably be there on the 10th to hear oral arguments and be able to vote on this case. Without getting into all of the details of this case, basically it challenges the idea that of the individual mandate, which was part of the Affordable Care Act, which was upheld in an earlier court decision because it's considered a tax. In earlier separate legislation this year, or actually several years ago, Congress reduced the penalty for the individual mandate down to 0. And therefore the challenge is, if the penalty is 0, then it can no longer stand as a tax. And the plaintiffs in this case are saying that if the individual mandate is struck down, then in fact the entire Affordable Care Act should be struck down. It has been regarded by many sort of legal observers as not a very strong argument against the law, and yet it has made it through several rounds of appeals and into the Supreme Court. And so obviously so much is at stake if the Affordable Care Act were to be struck down, not just the coverage provisions, but also the protections for people with pre-existing conditions. And it would really, at this point, after almost 10 years, the Affordable Care, or more than 10 years, the Affordable Care Act is really woven into the healthcare system, and so it would cause major chaos there. And I think Senate Democrats have been focused very clearly on this, given the popularity of healthcare as an election issue. Obviously, as always with the Supreme Court, the other main focus has been on Roe versus Wade. The court's holding in 1974 that there is a constitutional right to an abortion, and that, you know, there's a general sense that a 6-3 conservative court, while it may or may not directly overturn Roe versus Wade, certainly that possibility is considered more likely in a court that is not as evenly divided between liberals and conservatives. Of course, those are just two of the many, many, many issues, including questions of federal power, economic policy, you know, what workers' rights, what legislation can actually be ruled constitutional or not, that could really come into the picture with the change in the Affordable Care Act. Thank you so much, Keith, for that note on the hearings just concluded. So we got up to the minute information there, and Keith shares with us that the vote will be held October 22nd. So we'll be keeping obviously a close eye on that. But those are the main things I think happening in Washington at this point. You know, obviously a lot will potentially change or will be affected by the outcomes of the election, something I know everyone is watching. We will be back for another webinar later in the year to talk about what some of the election means. So we probably won't do a lot of crystal ball predictions today, but I think you can count on us to be back to talk about some of the implications of what we see in just a couple of weeks. But speaking of the election, I did want to now hand it over to Chris, who's done some really terrific work and found some really exciting new partners for the foundation when it comes to voting and what we need to know about voting in a pandemic. So Chris, take it away.
Thank you, John. Yeah, we can't talk about the election and leave out the most important factor of an election, which is the actual voters themselves. And it's really important for us at the foundation here that we make sure everyone has all the resources that they need and are armed with as much knowledge to get out there and to cast their vote in this really strange time. So first among that, and we have the link here on our slide, but I'll also drop it in the chat here for anyone who wants to check it out. We unveiled this voter guide late last month, where you can go there and it's broken down state by state. You can see the voter registration deadlines, the deadlines for sending in your application for an absentee ballot, and a little write-up on a particular disability service that state might offer. We were all quickly becoming aware that the state of voting is drastically different depending on what state you're in, and even, you know, from county to county in the same state. So we encourage you to check that out before you make your plan. And in making that plan, a couple of things that are really important to keep in mind is we have the list here on the slideshow. Definitely check the Department of Elections website for any specific information, and I'm going to reiterate that probably 100 times as I go through these 3 slides. Really use this information as a jumping off point. It's really important to double check and to verify as much of this as you can, because so much is changing on the fly here, especially as we're seeing lower courts are coming back with decisions about what the U.S. Postal Service is or isn't allowed to do. We're seeing long lines in the state of Georgia, which is probably signaling other things to other states about what voting might look like on election day. So please double check your election website. Can you vote early? You know, there are 6 states in this country that do not allow early voting. So make sure that whether or not you live in one of those states. If you're filling out your ballot by mail, make sure that you've double and triple checked where your ballot is supposed to go. I know I live here in Tacoma Park, Maryland, and we have an adorable little box at City Hall where we can go and drop our ballots off. Some states, some municipalities would prefer you to bring that to the local Department of Elections office, or they may want you to just send it in the mail. These are good things to look into. And probably most importantly, if you're voting absentee is to be sure to read all of the instructions very, very, very carefully. Especially if we're anticipating, both sides are going to have questions and some challenges about the legitimacy of ballots. The actual accuracy by which an individual voter fills out their mail-in ballot, dotting all of the right T's or I's, excuse me, crossing all of the right T's is going to be really important to make sure that your vote is counted. So be sure that you read all the instructions very carefully. And with that comes issues like showing ID. If you're a first-time voter, you may need to provide a copy of your identification in the package that you send off to your election officials. Check and make sure that your polling place hasn't changed. Again, here in Washington, D.C., I know they've opened up Capital One Arena where the Caps play hockey will now be a voting place. And we're seeing that in many counties all over this country. Places that were not previously used for voting are now going to be opened up to allow for some social distancing. So these are things that we just want you to double, triple check as much as you can. So we wanted to bring those to your attention. And last but not least, if you are someone who's planning on, I was going to say someone planning on voting day, but even if you're planning on voting early, but in person, just prepare for a long line. Just assume that everyone else around you is going to be showing up at the same polling place at exactly the same time that you get there, and prepare yourself and plan accordingly. So thanks, we can move on to the next slide here. Now, if you are planning on voting in person, and again, this is, maybe you're doing it on November 3rd, or you're planning on voting in person early. First thing I will note is that the CDC guidelines, the first thing that they mention about ensuring that you can cast a safe ballot is to look into alternative ways of voting, be that by mail or absentee or whatever it is. However, understand that's not a possibility for everybody. So the follow-up advice that they give is just to practice all of the guidelines that they've been telling us to do for months now. Maintain as much socially distanced as you can. Make sure you wear a face covering, bring a mask, keep your hand hygiene good, wash your hands, bring your hand sanitizer, bring your own pen. And there's some questions on gloves. I had seen some sources that had mentioned that if you're a person who likes to wear gloves, then you can do that, but I understand there might be some competing theories about the effectiveness of wearing gloves. So please, I encourage you to check other sources on that matter. Another thing that I would encourage you to double check on, this is some feedback that we got from members of the community. If you're an individual who's in a wheelchair, if you're planning on accompanying someone to the polls who's in a wheelchair, some districts like to move those people to the front of the line. I've also heard it suggested that they prefer those people people in wheelchairs to kind of hang back and go after everyone else to ensure that they have enough time to vote. These are things that you might want to call your Department of Elections to double or triple check on before you arrive. And I know, for example, the state of Texas does curbside voting, where you can show up to a polling place on election day with the ballot that you filled out ahead of time, and they just advise you to call your polling place before you arrive so that someone can come out and meet you at the curb, and you can hand them your ballot, and they can make sure it gets in the right drop box for that. We know this is unfortunately an all too common event where polling places are not accessible to individuals with disabilities. And we wanted to do our diligence to give you some resources on what you might do if that's the case. And unfortunately, if you were to show up on election day and find your polling place to be inaccessible, you definitely want to bring it to the attention of the poll workers that are there. But as far as there being any sort of centralized authority that you can call, unfortunately, there isn't. However, the Department of Justice Public Integrity Division and the Department of Justice Civil Rights Division are available to take formal complaints about this very important issue, and to essentially do work after the fact to follow up and to make sure that it doesn't happen the next time around. So while we wish there was a phone number that we could call to clear those issues up while we're at the polls, we have not been able to find one. However, we can add these links in our follow-up email for the Department of Justice, and then of course your State Board of Elections. And bring someone with you if you can. This is really important if you're expecting any type of barriers to stand in your way when you get there. Some states do allow you to bring a person into the voting booth with you. If they're a family member or friend, again, look that up, because many states have very specific rules over who is allowed to accompany a person into a voting booth. But if you can bring a friend or a family member, might be a good idea. That way you can hold your place in line. They can go, ahead of you, talk to polling workers, make sure that everything is all set and good to go for when it is your turn to cast your ballot. And next slide. So we are going to continue to look at this really important issue of voter turnout amongst Americans with disabilities, and we're really, really excited to be offering this new webinar on Monday, October 19th at 3 p.m. We are going to be joined by Dr. Doug Cruz and Dr. Lisa Shore of Rutgers University. They are co-directors of the Rutgers Program for Disability Research, and they're really the leading researchers, seems in America right now, on the participation gap between people who live without disabilities and those who live with disabilities, and looking at some of the contributing factors to what is creating this 4.7% gap in voter turnout, which accounts for over 2 million votes. In talking with Dr. Cruz and Dr. Shore, I was surprised to find out that Americans with disabilities are a voting bloc of about 38 million people, which is sizable voting bloc in this country, yet they're rarely addressed directly by people running for office. And one thing that they noted in their research is that part of a contributing factor to that participation gap is that very lack of appeal from people running for office and from organizations. So we're really happy to have had the opportunity to get some space at this webinar to talk about this issue, and just reiterate that everyone's voice matters when it comes to elections, and really happy to be an organization to address this important issue, and to hopefully give you all some information that you can use in casting your ballot. So thank you for your time.
Thank you so much, Chris. Before we get to our Team Reeve event, I just want to acknowledge Keith Napier, who's one of our fantastic and dedicated regional champions from Indiana. He put in the Q&A section 2 important points that I just want to highlight. The first one, he has a friend who just completed training for becoming a poll worker on voting day. And his advice for voting day, or her advice for voting day, is if you're checking in at the polls and they happen to write anything on your ballot before they give it to you, and a letter, check mark, a star, an R, D, anything, please request a new ballot, because we wouldn't want your ballot to be disqualified if it's written on before you have a chance to actually cast your ballot. So thank you for that note, Keith. And also, if you're in
it's great information. Sorry, Kim.
Oh, no, that's okay. It is great information and really important. And then also, Indiana absentee ballots, should you be from Indiana, are due by 12 noon on election day as per verdict of the Supreme Court. Keith also noted, I just want to highlight also, when we were talking about the Supreme Court nominee, he mentioned, that we don't know how Judge Barrett will vote on these issues, and that is 100% correct. We have no idea. And he also noted that she has a child with special needs, perhaps that may or may not influence some of her thoughts on some of these issues. However, she's been very clear that she will review cases with judicial review and attention, just like any of the other judges. So we, again, as I mentioned, we have no idea how she would vote. So thank you so much, Keith, on those really important points. And I know on behalf of Chris and John, we're just so grateful for all the continued advocacy that everyone has been doing, especially during this time. And we really, really appreciate it. Every time John and Chris and I contact the Hill, they always tell us that they love hearing from all of you, and that really, really makes a difference. So I just want to make sure that everyone knows how much we appreciate that. So before we get to the end, and if you have any additional questions for us, I just want to highlight, our Team Reef program is one of our key fundraising mechanisms for the foundation, especially as we raise funds for finding a cure and treatments for spinal cord injury and paralysis. And unfortunately, because of the pandemic, a lot of our endurance events in-person events have had to be canceled, including the New York Marathon, the Chicago Marathon, which were huge vehicles for fundraising for the Reeve Foundation. So this year we are doing, and we're really excited because we want to get huge numbers involved for our first annual run, roll, cycle, or walk, or swim, whatever you'd like to do that you can do safely, on October 17th. And you in fact have an entire week to complete the 5K, or if you'd like to just register and provide a donation, we would be so grateful for that as well. And I just want to give you some statistics, because not only is it US based, but we also have some participation from around the world as well. So as of this morning, we have 720 registrants. We have a total of 1,536 total donations. 49 states are represented. So if anyone on this webinar knows anyone or is from North Dakota, we really encourage you to register. So we have full representation from every state and territory. And currently, countries represented are from Australia, the UK, Sweden, Singapore, Spain, Germany, and Canada. And I know we have a participant on our webinar from Canada, so thank you so much if that's you. And we hope you'll check out our link there, and we'll also provide that in the follow-up as well. So we hope you are able to sign up and participate. And I think there's some social media activities if you want to upload or send us photos of your participation. We would really welcome that as well. So thank you so much. And John and Chris, I don't know if you have anything you'd like to add before we get to questions. I don't see any questions right now, but I want to give folks a chance to send them if they do.
No, I think that's great. And thank you, Kim, for those, and Chris for the really great voting information. I think this is the time of year where we all just need to make sure that we've either voted or have a plan for voting. And you can celebrate your vote by then enrolling in the 5K and celebrate that way. So it's a nice way to finish off the webinar after some frustrating news, I think, frankly, from Washington.
Okay, it looks like we have thankfully answered everyone's questions. If we have not, feel free to ask Chris, contact Chris directly. You'll be hearing from him. Again, we're so grateful for your participation. We hope everyone remains safe and healthy. And we look forward to, we'll be having a post-election webinar. We'll see where we are after November 3rd and be able to report back. Oh, and just as a reminder, we're so focused on, and I know many of you all know this, but we're so focused on the presidential election. There are Senate seats up, as well as every single House member too, and of course all your local officials. So this is not just a presidential election, which it seems that it feels that way, but it's not. And so your vote is really, really important.
All right, thanks so much, everybody.
Thanks so much. Take care, everyone.